Good morning, I'm Adam Sexton. A year ago this Sunday, we were coming to you from the snow-swept and very flat landscape of Iowa before what turned out to be a disastrous caucus process. Not long after that, the conversation shifted to pandemic curves and now, months later, COVID-19 vaccines. We've benefited greatly by hearing from some of the top doctors at Dartmouth-Hitchcock to get a deeper understanding of what's going on. And another one is joining us this morning, Dr. Jose Mercado, an associate hospital epidemiologist. Thank you for connecting with us, Doctor.
Glad to be here, Adam.
So I want to start with your perspective on where we're at in the vaccination process. It's remarkable that these vaccines are here now in the first place, but are we getting enough shots in enough arms right now that we are on track to, quote unquote, get back to normal by the end of 2021?
I agree that that's a very important question. And I think, the biggest hurdle right now is the vaccine allocation. We just don't have enough vaccines to get our shots in the arms. I would say that we're getting better at this as we figure out the logistics of how we get the vaccines to the community. And we've come a long way. So we've done our high and moderate risk healthcare workers. We've done our high and moderate risk healthcare workers. We're moving towards our high risk population. So very excited about that. I'm also very excited about the fact that we do have additional vaccines in the near future in terms of the Janssen and maybe the AstraZeneca. So hoping to see more vaccines so that we can figure out how to get that to our patients.
We are hearing a lot about COVID-19 variants these days, Doctor. So far, it looks like the vaccines we have are holding up to them. But if infection continues to run rampant, either here or in other parts of the world, is it just a matter of time, unfortunately, before one of these variants pops up that is more resistant to the vaccine?
That is possible, and that is the concern. So studies have now started to really look into our ability to neutralize this new variant, so to speak. And that's the beauty of having these messenger RNA vaccines, is that, they are being produced with a pandemic in mind. It may be that we would have to have booster doses to cover this new variants, but we'll have an answer hopefully soon about that. But the good news is that so far, from what we know, the vaccines are covering or are able to neutralize these new variants.
You mentioned booster shots, and that's one of the big worries right now that we're hearing from a lot of Granite Staters. They're scheduling that first shot, they're getting that first shot, and the booster shot, the second shot, is now being scheduled for a lot of people pretty far out. It can be 40 to 50 days in some cases. What's your perspective on this? That's not necessarily what was tested, but is it safe? Is it okay for people to receive shots so far apart?
Yes. I think that's what we would want. We need to trust the science. So the short answer to that is that we currently do not know. We do have some historical data based on other vaccines that do require booster shots, so to speak. And a common comparison is the influenza. We know that we get a different influenza virus every year, and that we would need to have the vaccine every year. But, that's why we need this clinical trials to really determine the safety and the efficacy of getting these booster shots.
What's your perspective on the Johnson & Johnson vaccine? We know that's just out, some of the data today about the 66% initial efficacy, but then it really goes up in terms of just needing that one shot, and it looks like the effectiveness in preventing death is very good. So what are your thoughts right now, just seeing what's come out already?
Yeah, I think I'm very excited about what we're seeing. Initially, I was excited with the possible option of having a one-dose vaccine, but that was pretty exciting to hear, too, that there was a boost in the immune response with the second dose. I think outside of the benefits of having more vaccines vaccine to give to the community. I think the other thing that we all would benefit from is this doesn't need the ultra cold freezers that we need for the messenger RNA vaccine. So logistically, it would be easier for us to handle these vaccines, and we would be less concerned about them expiring. So I think the more vaccines, the better.
And certainly going to be a big help in those countries where they don't have those cold chain supply chains as well. Doctor, we've heard so much at the outset of this pandemic about that multi-system inflammatory syndrome in children related to COVID-19. Not so much anymore. Why is that?
Well, I think as time goes by, we just learn more about the disease. And I think time would just really dictate how much this affects our younger population. But that's good news to me. I think, again, going back, we just need to trust the science and look at the evidence and to be able to determine how, we were in the diagnosis and treatment phase, and now we're maybe moving towards a prevention phase. So we need to figure out certain risk factors and ways to prevent these severe disease from happening.
What about kids in schools? We're seeing more data that the transmission rate of children, especially small children in school, is very low. And just now, Dr. Fauci is coming out and saying we need to take more of a look at getting kids back in the classroom. What's your perspective on that?
Yeah, I agree with that. So I think our schools have done a great job of putting and adapting the mitigation practices also to keep our kids safe. I think that we need to look at the data really to see because we know that there are adverse effects when we keep our kids at school, and we are interdependent, we are social beings, and the data seem to be behind that our kids need that to be able to continue to function and develop. So I think I would favor finding ways to keeping our kids at school.
Talking more about that interdependency, when people get vaccinated, the recommendation is still to continue distancing, masking, all of those things, just to really keep a lid on things. But what's your perspective on the flip side of that, the isolation that people are experiencing? There's clearly a real desire to want to break through that and get back to quote unquote normal. How do you balance that in your approach in terms of how people should behave once they are vaccinated?
Yes, I think, again, it's great that we have the vaccine, but we do need to be a little bit patient for us to achieve that herd immunity, because if we do it too soon, then it may not help the general community as far as breaking the chain of transmission. So as we wait for us to achieve what we call that herd immunity, we do need to continue to observe those preventive practices, such as wearing our masks. I would say it's physically distancing, not socially distancing, because we know that we need to keep our social lives and our coexistence intact, as for mental health. I do think that we would always need to think about washing our hands and follow the CDC guidelines around travel restrictions while we wait again for the community to achieve herd immunity.
What are some of the benchmarks you're going to be looking for in the weeks and months ahead? Is there a particular data point that we should all be paying attention to see potentially if this thing is going to go sideways again?
Yes, I think we're always looking at our percent positivity rates, our hospitalization rates. We've seen great things as far as the risk of severe disease and or even death as these new variants come in. So I think we need to continue to look at this data and how the virus is affecting our community, and really, again, focus on trying to prevent the virus from spreading, because it's easier. Prevention is key rather than, meaning being proactive rather than reactive to the situations. Is being proactive is better than being reactive.
All right, Dr. Jose Mercado, thank you so much for sharing your expertise with us on Close Up.